So talking about the next neurological issue, we're talking about what is known as ADHD. All right. So it's quite a thing, and most of the times when you see people talking about it, it's just the abbreviation they talk about: ADHD, ADHD, ADHD. So this is known as the attention deficit hyperactivity disorder. So from the word, you can see that maybe a patient can be having issues with what functioning well. Sometimes it could be that the patient is having issues with functioning too much. Do you understand? So for this one, it's a neurodevelopmental condition. So it affects how a person can be able to focus. All right. How can you be able to focus? For children, how can they be able to remember what they learned in school? How you can be able to control impulses, how you can be able to regulate activity levels. So it typically begins in childhood and can persist into adulthood. Can impact how you perform in school, can impact how you perform at work, can impact how you can actually keep your relationship with others. All right. So what are the symptoms? People that have this deficit, this disorder, inattention, they have difficulty sustaining attention in tasks or play. Like they start doing something, they can stop it along the way. All right. Frequent careless mistakes, troubles organizing activities. They are easily distracted. They can forget too. They avoid tasks requiring prolonged mental effort. So hyperactivity too, fidgeting or squirming, they're just some of them. When it comes to them, they are just everywhere. So they have inabilities to actually stay in one place, stay seated. Excessive talking or movement, difficulties engaging in quiet activities. Impulsivity, they can interrupt others. All right. They have difficulties waiting for their turn. All right. Acting without thinking about the consequences. So causes and risk factors is you can't actually pinpoint one thing causing it. Genetics, some people is genetics, some people is just how they were trained. Yes. So maybe for genetic or inheritance, there's a family history of this attention deficit hyperactivity disorder. Maybe you have been exposed to toxins when you were an infant. Premature birth or low birth weight, maternal substance use. Your mother was abusing drugs or alcohols and all of that during pregnancy. Diagnosis is you just want to assess the behavior of the person. You want to take a history of how the person has been all this while. Was he born like this, or did he actually started this of recent? Alright, standardized rating scales rule out other conditions like anxiety or learning disorders or autism, which we'll later talk about. So this is just a summary of the symptoms of what attention deficit hyperactivity disorder. Please, you can pause to look at it. So treatment is manageable, not curable. Alright, so you can actually give stimulants, non-stimulant, depending on the issue of the person. Some people, they are just dull, give stimulants. Some people, they are everywhere, busybody, so you give non-stimulants. So therapies like behavioral therapy, parental training and support, social skill training, cognitive behavioral therapies. Also lifestyle things like what structured routines, physical activity, they should sleep well. All right, then you can take them to special schools that could actually deal with such issues. All right.